Morning, Chris Ohl, Wake Forest School of Medicine, Infectious Diseases. Happy New Year. I think it's a Happy New Year. I'm pretty sure it's going to be Happy New Year. I'll tell you why when we get towards the end of this. Where are we with COVID right now? Omicron's here throughout the state, including the Triad and down in the greater Charlotte area, and in fact just about everywhere. Looks like, I haven't seen all of the sequencing data yet this week, but I would say that the CDC's estimates that Omicron represents more than 50% of the COVID that's circulating in their area is likely very true. And this is based on looking at epi curves and absolute numbers. And so we have 2, 3, 4 more weeks of Omicron to get through, I think. But it's going to be a tough time for the following reasons. One, right now our case rates that we measure here in Forsyth County are at 64 per 100,000 per day. Guilford County just a little tad bit lower than that. Mecklenburg is at 91 per 100,000 per day, and in the region, the county who's winning is Yadkin County, which is around 90-some, 100%, or 100 cases per 100,000 per day. The numbers are likely a bit underreported for a lot of reasons. One is that during the holidays people would rather just stay home when they're not feeling well rather than go out and find a test. Two is tests are hard to find right now. We'll talk more about that a little bit. And three is because of home testing, not everyone reports those results to the public health system. So is the lack of reporting a home test a problem for us? We would rather have them reported, and so we have very accurate counts, but we still have a pretty good idea what's going on because we can look at the shape of the epi curves and how they go up and how they go down again. And we've always tried to account some for underreporting, which happens with any infectious diseases. So I think we'll be able to still provide accurate information for hospitals and communities and for individuals and families on how to respond, even though home testing may not 100% be reported. How are our hospitals doing? Well, they're busier. We're always busier in January and February. This is cold and flu season. And if you want to find a busy hospital, go in January and February, and that's when you'll find them. And it doesn't matter if there's COVID around or not. So our hospitals are busier, definitely, than they were 3 weeks ago. But I can tell you that based on the explosive case rates that are going on in our community, hospitalizations are not going up as fast. It'll take another week or so to know whether that trend will continue, but there's probably some reasons for that. One is that as Omicron replaces Delta, Omicron's less likely to result in hospitalization, particularly in people who've been vaccinated and boosted, and then or previously infected. So between immunity of the population and a virus that tends to behave a bit differently, hospitalizations I don't think are going to be quite the problem they were at this time last year. Between Omicron and Delta, the one that I would rather not have in my community, if that's a double negative maybe, is Delta. Delta seems to be a little bit nastier and is more likely to land people in the hospital, even compared to the wild-type virus and other variants that we had earlier. So if Omicron can completely replace Delta, it'll help some with hospitalization rates. And what is a rate? Is the number of people landing in the hospital divided by the number of people getting infected. Now, having said that, if tons and tons and tons and tons of people are getting infected, there'll still be, even if a smaller proportion are needing to go to the hospital, there'll still be busy hospitals around. Interestingly, our ICUs are not as busy right now. Even though our case rates are higher than they were absolutely than with the Delta, our ICUs are not as busy as they were then. We'll see. It takes about 10 to 14 days to know, because it takes a while for a person to acquire the infection, then get sick from the infection, then get sick enough to go to the ICU. But right now, they're not as busy. It's still the same, though, as it's always been as far as hospitalizations go. 90 to 95% of the people who are in our hospitals have never received a COVID vaccine. And when we talk a little bit about how Omicron's going to affect us throughout the month of January, that'll become important, because that's a group of people that we have to think about differently. I was asked a question about how we're doing with vaccination rates. We're still vaccinating people. Over the holidays, it slowed down. We needed to give some of our healthcare workers breaks to get a chance to breathe here. And then also, people were busy with their families and celebrating the holidays, so less people came forward for vaccinations. We did see a surge in people wanting booster vaccines before Christmas, and that's a good sign. So when we get the absolute numbers for our vaccinations updated after the holidays, I'll be happy to report those. But roughly, about 70% of people who are over the age of 18, at least here in Forsyth County, not much difference in Mecklenburg, have gotten a 2-dose series. We don't keep data on the number of booster doses yet, and so it's a little bit hard to estimate. And I know I was asked this by the media prior to the Christmas holiday, but it's probably somewhere around 40% of people who have gotten their initial series have gotten a booster dose. Not high enough, but we've still got time. So a little bit this week, lots of new news to go through. First one is that home kits are unreliable. I think that's an overstatement from the media, reflected on the FDA's assessment of home kits for Omicron. The sensitivity of the home kit for Omicron is a little bit reduced, but it remains unclear whether that really is significant enough to not use them. And I still think they're a useful tool to have in our communities and our populations for people to use to self-test. And so I wouldn't throw them out. I think they're still helpful. If you have colds and sniffles right now, and you have flu-like symptoms, and you do a home test and it's positive, that's it. You got it. It's COVID. The problem with sensitivity is sometimes if it's negative. So I think the way people could navigate that, if you're not feeling well, if you've got flu-like symptoms, and even if the home test is negative, you're not going to want to go and expose a bunch of people anyway. If you had the flu, would you go to a party? If you had a bad cold, would you go hang out with your older grandmother? Probably not. So just if the test is negative and you're sick, act accordingly and use some common sense. So what's going to happen here? So what's the thing with Omicron now? As Omicron becomes the more prevalent over the next 2 to 3 weeks, our case numbers will go up. It is a milder infection, I think, and to reiterate, for 2 reasons. One is that the virus acts a little differently, and where it initially infects is differently. It is much more likely to attach to and infect predominantly the upper part of your body, that part above the voice box, up this way, between the nose and the voice box. It's less likely to go to the lungs, and it's less likely to cause pneumonia. And that makes it a bit less of a severe virus. That's combined with a high prevalence of partial immunity in our population, either from previous infection or from the initial vaccine series. And then also, if you've gotten boosted, more than a partial, but almost a complete protection from Omicron. So the two of those act together to make the virus less severe. So what is this actually? And I've been talking about this for 6 to 9 months now, that how will the pandemic end is that the virus that causes COVID, SARS-CoV-2, is going to transition from being a pandemic, epidemic virus into being an endemic virus that causes colds. This is a bit of that transition, but unfortunately it's still a very contagious virus. So for those people who are vaccinated, it's a pretty contagious cold. And so that's something we're going to have to live with for a little while. But what it means is, particularly for the vaccinated population, that it's going to be less severe, and it's going to be more of an annoyance and more of have an impact on your activities. So it's going to be a pain in the fact that you may not be able to do what you wanted to do during the time while you're infected. In response to that, the CDC has changed their quarantine and isolation guidelines. We'll get to that in a minute. I've been seeing something, though, and again, I'm talking about the vaccinated population in particular, that there's a bit of a lag in the psychology in some groups of people in how they're thinking about COVID. And there was a really good article in the Washington Post that I read and thought about for a long time, and how vaccinated and boosted people who've been working really hard with masking, staying outdoors at the restaurants, doing everything to try to avoid getting the virus, are now getting infected. You know, maybe they went to a cookie making party over Christmas with a couple, 3 other families, and they got infected then. And it really hits them as like they've had a total failure. And I really implore people to start to change a little bit the way you think about getting COVID. Would you be upset and horrified and feel like a failure if you got a cold? Probably not. Would you feel that way even if you got the flu right during the middle of flu season? Probably not. And so that's the way to start thinking about COVID. Now, this is for the vaccinated population, particularly for the vaccinated and boosted population. And so the transition means that we have to have a transition in our way of thinking about the virus to some extent. Now, there are certain groups of people where these rules may not pertain. One is in the unvaccinated population. The unvaccinated population is going to have just as difficult of a time with Omicron as it did with our prior viruses. Now, these are the people who are more likely to have more serious infection. These are the people who are more likely to end up in the hospital, and frankly, these are the people who are more likely going to die. What would be your absolute risk of death in all comers? If you put together all ages and all comers, the mortality rate in the unvaccinated population is still somewhere between 2 to 4%. And that's high. So that's one population where that's going to be having more of a difficult time this month. The other population are people who don't respond to vaccines, and this include our immunocompromised people and people who are at the extremes of age. And we still have to look out for them, and it is still our community responsibilities to try to keep circulation of the virus during the time when it's explosive down as low as possible. The immunocompromised population is one that's going to have to take extra precautions. during the next month. And we can, at the end, if I get reminded about immunocompromised, we can talk about what those precautions might be. The third group of people are going to be people who got previously infected earlier in the year. Now, it looks like previous infection does provide some protection from going into the hospital, but previous infection from the earlier viruses does provide some protection from serious disease still. But the protection from getting symptomatic COVID, like a flu-like COVID, is probably less than 15%. So if you're exposed to Omicron and you're relying on a previous COVID infection to keep you from getting sick, it's not going to work. You're going to get COVID. And you're going to get symptoms that, even though you may be more likely not to be hospitalized, it's going to be pretty bad cold or flu. So that group of people, it looks like, really benefits from getting vaccinated on top of their previous infection. And it's not too late to do so. So if you were relying on a previous infection, say way back in March of 2020 or June of 2020 when it was going through, or even up through the previous Delta wave, and you haven't had a vaccine, go get it. Top it off. Give that previous infection a big boost by getting a 2-shot series of a messenger RNA vaccine. If you do that, you're actually 85% protected from symptomatic COVID, 85% protective even from the cold, and very unlikely to go into the hospital if you do that. Same thing with previously vaccinated people. If previously vaccinated, let's say you got your 2-shot series when it first came out last April of 2021, and you get a booster now, 85% protected from symptomatic COVID, and highly unlikely not to go into the hospital. So these are things that people can do even now. It's not too late to go get those. But it's the unvaccinated group that's really going to have the trouble in the next month. And that's reflected, just like I said earlier, over 90% of the people in our hospital, and 100% right now, the people who are on ventilators in our hospital have never seen a COVID vaccine. How long will Omicron last? Well, I'm relying a little bit on data from other places in the world where it hit first. But you kind of have to take into account a few things about that data. So case counts in South Africa, where Omicron first surfaced, are coming down. And they're coming down about as fast as they went up. So it was a pretty rapid increase, and then a very, very high peak, and then it's been a pretty rapid decrease. In fact, that whole cycle was about 4 to 5 weeks, which isn't all that long. Denmark's cases are coming down. They were one of the first countries to have it go up. UK, we'll have to wait and see. They're still going up, but if the thought is that this is a rapid increase and then a pretty rapid decrease, the UK should start going down in another week or two. So if you want to watch a country that might be our barometer for how to predict what Omicron will do here in January, the UK is one to look at. But there's a lot of differences between South Africa and Denmark and here. Denmark instituted a lot of other restriction measures to keep people from getting together. We haven't done that here in the U.S. South Africa is generally a younger country. There's not as many elderly people or immunocompromised people, so we'll have to wait and see how that happens here in the United States. But generally, I think that by the time we get out of our cold and flu season, which usually is the end of February, early part of March, about the time the daffodils come up, Omicron will be a significant less of a problem than it is now. And I hope my predictions are correct, but that's what I think. So what are we going to do in the interim? Well, here's what I recommend. One, if you haven't been vaccinated, get vaccinated. I've been saying that now since the vaccines first came out, over a year ago now. If you haven't been boosted, and it's been more than 6 months since your messenger RNA vaccine, or more than 2 months since your Johnson & Johnson vaccine, go get boosted. It's simple and an easy thing to do. What kind of booster should you get? You know, it depends a little bit. If let's say you got Pfizer in the first time around, and you got your 2 shots of Pfizer, and now you're going to get boosted. You want to get Moderna, you want to get Pfizer as your booster. Probably doesn't matter too much, but if you want to switch, there's some data that shows it might be a little bit more protective. And so you could do that. If you got Moderna the first time, you could switch to Pfizer. If you go to the vaccine center and they say, all we got today is Moderna, and then you'll say, that's good enough for me, and get on, because the important thing is that you get it in you. If you get Johnson & Johnson the first time around, you want to get one of the other 2 messenger RNA vaccines, either Pfizer or Moderna's. So get boosted, get vaccinated. That's one thing you can do. 2 is that you can modify some of what you're doing. Do we need to come back to a total lockdown like we were at the very beginning of the pandemic? No, I don't think so. I don't think that's really congruent or with sliding into COVID being a endemic respiratory infection that causes colds for people. But so if you want to have a New Year's celebration, you can have it. I'm not saying party like it's 1999, to quote Prince, but you know, if you want to get together with a couple, 3 other families, and you know their vaccine status, I think that's fine. Can kids go to school? Yes, I think they can. What's going to determine whether schools can stay open or not is really going to be the impact of Omicron and COVID on the workforce. So, you know, how many teachers can come to work? How many substitutes can you get in when people get sick? You know, if half the kids in the class are home with colds and flus, that's a big impact on everybody else coming in. So we'll have to see, but that's going to be the main impact. That's going to be the main thing to watch for schools, is operations and how Omicron and COVID affects the workforce. But you know, other than that, you need to wear your mask, continue to wear your mask when you're out and about, and think about what you're doing. Do I really need to go to that book club meeting this month? Maybe I'll skip it. Maybe I'll do it virtually. So those are things that I think that people should be thinking about for the next month. For workplaces, for universities, for places that want to have socials and lunches and stuff, if you want to have a meeting, take the food out of the equation, move the food outside if you still want to have it, and get out the patio heaters, because that's when the masks come down. Have your meeting masked and have your people come together masked. Try to keep the size down. You know, if you're starting to get up over 50 to 100 people, it's probably too many. But those are all ways that I think we can get through this in January. And above all, if you get COVID, and you get a COVID cold, don't beat yourself up. And you know, do your isolation time, and realize that if you got Omicron in the next few weeks here, that's a pretty good booster that's going to give you a pretty good breadth of antibodies for down the road. It's not all doom and gloom. We've lived through colds before. We can live through these. Now, if you're unvaccinated, it may be a bit tougher. So, what do you do if you get it? You wake up feeling a little achy, got a bit of a headache, stuffy nose, sore throat, which, by the way, are the usual symptoms of Omicron in a previously vaccinated person, and in even unvaccinated people early on. What are you going to do? Well, monitor your symptoms, and you're going to have to isolate. We don't have to isolate now as long as we did before. The CDC changed their isolation criteria. What led to this change of isolation criteria? A lot of finger pointing going on between different groups and in the media. But here's the real lowdown. Why did the CDC change it? One is that the science shows that most people by day 5 have really shedding minimal virus. And so your virus shedding is highest in the day before you get symptoms, and then for the day about 3 or 4 days after symptoms. So by day 5, you're not shedding hardly any virus at all. And what little bit you are it looks like it's easily contained by a mask. I'm not going to go into why the studies show that and how the studies show that, but that's the case. And actually, that's the way it is for just about every other respiratory virus that we have, including all the other coronaviruses, is that viral shedding is pretty much gone by day 5. And that includes influenza. And so science allowed us to do that. It took a while to acquire that data and become confident of it, but I believe it. I've looked at it, and I think it's true. The second reason is that as COVID transitions, we just simply can't keep isolating and quarantining for 10 days. It's disruptive. Look at what it did to the airlines over the holidays. And so you have to walk a line a little bit. What's good enough for your period of isolation for a good amount, rather than say, well, we're going to prevent 100% of people from having transmissible virus, and you cut it down to 90. Is that good enough? Probably. And particularly if it allows you to continue to function. Because firemen still have to go to work, policemen still have to go to work, healthcare workers definitely have to go to work. I have to go to work, and so on and so forth. So 5 days, it really reduces the impact on our workforce. And it's not all just about the economy. It's about functioning of critical services. If 90% of the people in your grocery store are out from the meat department, are out on isolation and quarantine, there's going to be no meat in the counter. So cutting it down makes sense when the science supports it, and I think the science supports it. Lastly, and it really is a good point, since a lot of these infections are colds now in the vaccinated population, and you've got day 1, achy and stuffy, maybe a headache. Day 2, about the same. Day 3, hey, feeling better, headache's gone, stuffiness is still there, sore throat is gone. Day 4, I'm really on the road to recovery. By day 5, I'm fine. And you tell that person to sit for 10 days because they're not going to do it. And so it really increases the chances that people will isolate and quarantine for the duration that they're supposed to if we reduce the duration. So those are the 3 reasons why it was cut down. And I agree with them. And actually, if you go back over the archives of these Facebook Lives, I've been saying for quite a while now it's time to decrease our time for isolation and quarantine. And I said it at a school board meeting for quarantine for our kids. Yeah, obviously I support the idea. So that's what we need to do. It's a little bit complicated, but not horribly. If you get COVID and you've been vaccinated and boosted, you isolate for 5 days. If you get COVID and you're not boosted and or you've not been previously infected or boosted, how long do you isolate? 5 days. Now, for quarantine, it's a little bit different in that if you're vaccinated and boosted, you don't have to quarantine at all. If you've been vaccinated but not boosted or unvaccinated or previously infected, even within 90 days, you're supposed to quarantine for 5 days. Now, you can maybe modify that a little bit on that quarantine by testing every day while you're quarantined if you've not been vaccinated. But it's best if you've had contact with somebody to sit out for 5 days. Now, when you're done with your isolation period, if you're done with your quarantine period, here's a time to be super religious with your mask. And you may want to use a surgical mask instead of a cloth mask during that time frame. And even around people in the house, when you're in close quarters with them in the area, you'll want a mask for that extra 5 days. And so that's basically what it says for the community. Healthcare workers are a little bit different. We'll see for universities, I think it'll end up being a little bit different. There'll probably be more of a testing component to it. But for if you've had COVID and you tested positive and you're symptomatic or you're asymptomatic, it doesn't matter. You got a get out of jail free card at 5 days. As long as you're feeling better and haven't had a fever for 24 hours. So what do we do for the flu? We tell people if you have influenza to stay home for 24 to 48 hours after resolution of your fever. The usual duration of symptoms and fever for the flu is 3 days. So you add the 2 days after that, what do you get? 5 days. So it's all kind of coming together. So, one way to think about it is that the quarantine and isolation recommendations changing is one thing that changes as we slide from a pandemic endemic into, or a pandemic epidemic into a cold virus that persists in the population and becomes less common. Eventually, believe it or not, we won't be quarantining or isolating at all when you get COVID infections. And what is going to be the key to getting there is getting our vulnerable population protected and getting more people vaccinated and having more treatments available for people so when they get COVID, we can keep them out of trouble. Those treatments right now, I'm not going to go into it to a large extent, but most of the monoclonal antibodies won't work against Omicron. There's only one that does, and it's in very short supply right now. And so monoclonal antibody treatment's likely something you won't be getting for a couple weeks. There are 2 new approved oral drugs. We anticipate them to be rolled out by the end of this week. Or early next week at the latest, Paxlovid and Molnupiravir. Paxlovid looks to be a much more promising drug than Molnupiravir, and once Paxlovid production gets ramped up and there's enough for everybody, I don't think Molnupiravir will be used anymore. We also have intravenous treatments with remdesivir, which is what we've been using for hospitalized patients for a while, which is a little cumbersome to use. And probably doesn't provide the level of antiviral activity as Paxlovid. So Paxlovid's going to be our key until new drugs start to come up on the market. Right now, all of them are in short supply. So for the next few weeks, we'll all be rationing these, and it's going to be mostly immunocompromised people, particularly severely immunocompromised people. Who will be getting them. So that's a little bit on the treatment end of things. School will be coming up. We'll be talking more next week. I know it's after actually school starts, but we'll talk more next week about things one can do with school. Obviously, masking is more important than it's ever been in the schools. The most important thing in picking a mask for your kid is pick one that fits and fits well. If you're using a cloth mask, it should be a tight-fitting 2-ply tight knit cotton. If a surgical mask fits your child well and is comfortable for your child, then that might be a better choice. But the most important thing is that it fits and that your kid wears it over the nose and mouth and keeps it up to that level. So we're going to be masking in our schools. At least that's my very strong recommendation for a while. Reassess at the end of January, getting into February again. But that's it. Lastly, there's a question on here. What about impacts of Omicron on sports? Well, yes, there is a huge impact of Omicron on sports. I'm a big Packers fan, and I'm just dreading the fact that maybe this is the year they could go to the Super Bowl and they'll decide that COVID's going to cancel everything. It's taken a lot of players out of production, both in the college and the professional world. All of the major sports leagues and also the college, and I'm talking yesterday with people with the ACC, are going to be changing their quarantine and isolation, and it's probably going to more closely mirror what the CDC's recommended, and that's probably okay for sports. There'll be probably more of a testing component for some of these leagues, but right now there's too much difference between all of them to go into all the details on this. I know that both college and professional sports are wrestling with this, and they're trying to come up with something that will keep their athletes safe and keep transmission down, and so they can still play. And we'll see how it goes. Maybe it'll be okay, and we'll get through it all, and we'll have a Super Bowl, and the Packers will win. So. With that, any other questions from the group? Yeah.
So I've got a couple of questions from our Facebook audience. If you wouldn't mind answering them. I've got two. Actually, I've got three. The first one is, I don't know if you've heard that there were, I guess, several concerts. There's a concert in Greensboro that was canceled. There was recently a fairly large concert in Winston that was canceled due to the variant. What is your opinion on that? And then I'll ask my second question.
Yeah, so canceling large venue events like big concerts, it depends a little bit on, it depends on the details, on how it is. So, if it's a concert in a packed venue, like a club, where you can't even dance because you're so close to other people, it's not a good idea. But if you're outside in, the stadium or in a very large area, such as the Joel Coliseum, and people are spread out and it's well ventilated and there's a lot of air, then it might be okay. I think during the month of January, probably more of them will cancel than not cancel. The other thing you have to consider are the artists and the people who are coming to entertain, and they simply don't want to be exposed. They don't want to get sick. They have their own potential health issues, and so that has to be considered too for them, and I certainly understand that. For instance, bowl games, things like that. Not a concert, that's a sports activity. For the audience itself, I mean, most of these are outside, and it's going to be fine. So I still think, even with Omicron, that outside activities are still safe and okay as long as you're not crowded and packed in with people. It's kind of common sense. So your second question.
Yes, the other one is Dr. Cohen had talked a little bit about masks and the different types of masks and the different types of protection they offer. And she had suggested that people want to be better protected. They go out and get an N95 or KN and masks and those sort of masks? What was your
Yeah, so
for everyday people?
yeah, so for everyday use for masks, it's a little bit like we're talking about kids. The most important factor is that it fits and that you wear it right. And that means over the nose and the mouth. Where the fit sometimes falls apart on the mask is right up here around the nose. And it gets loose in that area. To know if your mask is working or not is stand in front of a mirror and breathe in and out, and you should see the mask come in and go out and come in and go out while you're doing that. A good cloth mask is just about as good as a surgical mask, but in most of the studies, the surgical mask's a little bit better. But the key here is making the surgical mask fit. Most of the surgical masks should have a little wire up on the top. So if that wire is on the bottom, you got it upside down. So the wire up on the top, and then you pinch it in around that area, around the bridge of your nose. And that makes it more fitting. If you're immunocompromised or older, what's older? Over 65, 70, somewhere in there, or have a lot of underlying health problems, and you're going out and about, that group of people, I would recommend wearing an N95 now. And an N95 confers the highest level of protection for viruses in the air. I personally am still wearing a cloth mask. When I see patients, I go with an N95 mask, but that's people who probably have COVID. So it's a little, for us in healthcare, that's what we do. And it works, by the way. We've been using high-level masks in healthcare since the beginning of this, and very, very few healthcare workers have gotten COVID from their patients, and that's with close and long exposures. So if it's good enough for us, it's good enough for the population, that's for sure. But when I'm out and about most places, when I'm going to the grocery store, I have a well-fitting, high fiber count cloth mask that has worked for me so far. And I'm continuing with that. But yes, particularly people who are more vulnerable should upgrade their masks.
Then my final question is that folks had asked about the Johnson & Johnson shot with this new variant. There's some new data that has come out, and supposedly some folks are a little. Should they get the J&J shot? Should they get the Moderna, Pfizer? I know you hit on this, but that seems to be
I think that if you're contemplating your initial vaccination series right now, and which I would applaud you, first of all, and have a little celebration, I'd go with one of the messenger RNA vaccines, and either Pfizer's or Moderna's. If you're going to get a Johnson & Johnson, clearly after 2 months you have to be boosted. Johnson & Johnson just doesn't give you quite as robust of an antibody response. And if you have questions between them, talk with your healthcare provider about them, because sometimes people have certain allergies or certain problems. If you have certain clotting risks, or in your certain age groups, and you're female, you won't want to get Johnson & Johnson, but it's safe to get the Pfizer vaccine. So, but for most people, I think I'd go with the messenger RNA vaccine. Any other questions?
We had WFMY come in and ask if there have been more breakthrough cases with Omicron, as well as if there is a metric that we're looking at that would raise a concern.
So are there more, so the question is are there, from our colleagues at WFMY, are there more breakthrough infections with Omicron? Yeah, clearly. In fact, that's one of the reasons why the numbers are so high, is because of breakthrough infections. And that's breakthrough infections in people who've been previously infected in the past with a different variant, and with people who've gotten their initial vaccine series but haven't been boosted. If you've been boosted after your initial vaccine series, and that boosting should be at about 6 months after your initial series, If you've been boosted, breakthrough infections are a lot less likely. And in fact, out of 100 people who've been boosted, who've been exposed to Omicron, about 15 of them will get a breakthrough. About 85 won't. So that's the way to not get a breakthrough infection. But yeah, that's why, a breakthrough infection is basically getting a COVID cold when you've been vaccinated. So. That it? All right, we'll see you here next Thursday morning.